Assalamu alaikum students. I will discuss monogenic disorders today. These are disorders caused by mutation in single gene with large effect. These include mutation in genes encoding structure proteins, for example in Marfan syndromes and Ehlers-Danlos syndromes, mutation in gene encoding receptor proteins or channels, like in Familial Hypercholestrolemia and Cystic Fibrosis, and the other is mutation in genes encoding enzyme proteins. So examples are Glycogen storage diseases, Lysosomal storage diseases, and Phenylketonuria. Disease is caused by mutation in genes encoding structured proteins. Marfan syndrome. Marfan syndrome is a genetic disorder that affects the body's connective tissue. It's caused by a mutation in fibrillin 1 gene that determines the structure of fibrin. So this fibrin is an important part of extracellular matrix. It's the main protein of microfibrils, including elastic fibers. It's abundant in aorta, ligaments, and ciliary body of the eye. Marfan syndrome is due to mutation in fibrillin 1 gene that occurs on chromosome 50. System affected are skeletal, oral, eyes, cardiovascular, central nervous system, skin, and pulmonary. In skeletal system, many individuals develop abnormal growth of their chest. Many people with this syndrome grow up to 7 feet or tall. There are some clinical manifestations: joint hypermobility, thumb sign, wrist sign, reduced elbow extension to less than 170 degree. It also affects long bones. Arm span is more than height. They have long narrow face. Sternal deformities include pectus excavatum and pectus carinatum. Some of the patients have scoliosis and flat feet. Here you can see thumb sign. If you ask patient to make a fist, thumb goes out of the radial border of the hand because the length of thumb is increased in Marfan syndrome. The B part shows wrist sign. When you ask patient to hold the wrist with ring finger and thumb, they overlap because the length of finger and thumb is increased. You can see here thumb curls backward because of hypermobility of the joint. In eyes, patients can have lens dislocation, position can change, myopia, glaucoma, cataract, and retinal detachment are other manifestations. You can see here, lens is dislocated here. It goes towards vitreous cavities. In cardiovascular system, patient may have mitral valve prolapse. 60 to 80% of patients present with shortness of breath, fatigue, and palpitation. They also have vascular changes, aortic dilatation, and rupture. Workup include history, eye examination for lens dislocation, and echocardiography for aortic root dilatation. Cause of death in people with Marfan syndrome are complications with the heart. Since the aorta is enlarging and thinning, rupture can lead to heart failure. Prevention is not possible because it's an inherited genetic defect that affects the connective tissue. Due to Marfan syndrome, many athletes sometimes die without warning. The average age of death for people is 32. Ehlers-Danlos Syndrome, that is disorder of collagen fibers. Abnormalities in collagen biosynthesis which affect multi-organs. Clinical manifestations are joint hyperextensibility, hypermobility, skin and vessel fragility, and fish mouth. 7 to 11 types are identified. They present with mitral valve prolapse, blue sclera, vascular aneurysm, aortic dissection, hernias, and others. Patients with type 4 are prone to arterial rupture and have the highest mortality. So the next group is disease caused by mutation in genes encoding receptor proteins or chain. Here are some glycogen storage diseases. There are different classes of glycogen storage disease based on the enzyme deficiency due to mutation in genes. Von Goerke's disease presents with severe hypoglycemia, lactic acidosis, hepatomegaly caused by deficient glucose 6-phosphatase. While Pompe is caused by lysosomal alpha-1 glucosidase, presents with cardiomegaly, muscle weakness, and death. Corey disease presents with mild hypoglycemia and liver enlargement. It occurs due to deficiency of D-branching enzyme, while Anderson is due to deficiency of branching enzyme and present with infantile hypotonia and cirrhosis. McCardle is due to muscle glycogen phosphorylase deficiency and patient present with muscle cramps, weakness, and myoglobinuria, while HERS is due to hepatic glycogen phosphorylase deficiency. So manifestations are mild fasting hypoglycemia, hepatomegaly, and cirrhosis. I already told you about Von Goerke's disease, Pompe disease, Corey, Anderson, McCardle, and HERS. Moving on to lysosomal storage disease. There are different types: sphingolipidosis, sulfatidosis, mucopolysaccharidosis. So normally the different complex substrates are degraded by lysosomes, and when the enzymes are deficient, complex substrates are accumulated in the cells. So defective fusion of autophagosome with lysosome cause defective degradation of intracellular organelles that cause accumulation of toxic proteins leading to cell death. So these toxic metabolites cause cell death. History of the disease. Ernest Gaucher discovered these Gaucher cells that appears like wrinkled tissue paper under microscope. So there are different types of lysosomal storage diseases: Tay-Sachs caused by hexoaminidase deficiency, Fabry caused by alpha-galactosidase deficiency, Gaucher is caused by beta-glucosidase, Niemann-Pick is caused by sphingomyelinase, while Crab is caused by deficiency of sphingomyelinase. So in all these diseases, different metabolites are accumulated, like gangliosides are accumulated in sphingolipidosis, glucocerebrosidase, sphingomyelin, and ceramide are accumulated in sulfatidosis. This is the Gaucher cell. You can see here, cytoplasm appear like wrinkled tissue paper, while under electron microscopy, laminated membranes are seen. Phenylketonuria. It's characterized by inability of body to utilize the essential amino acid phenylalanine. In phenylketonuria, phenylalanine hydroxylase completely or nearly is deficient due to mutation. In normal individual, phenylalanine in food is converted into tyrosine by the enzyme phenylalanine hydroxylase. But in individual with mutant phenylalanine hydroxylase enzyme, phenylalanine accumulates and excess is broken down into harmful metabolites. This enzyme normally converts phenylalanine to tyrosine, which is utilized by the body. When this is deficient, phenylalanine and its breakdown chemicals from other enzyme routes accumulate in the body and body tissue. Symptoms include vomiting, irritability, eczema-like rash, unusual odor to urine, nervous system problem, microcephaly, and decreased body growth. What happens when there is too much blood phenylalanine? High levels of phenylalanine and some of its breakdown products cause significant brain problems. Alkaptonuria is caused by deficiency of homogenic oxidase. It's involved in metabolism of tyrosine phenylalanine. Deficiency of enzyme causes accumulation of homogenic acid Urine turns darker on standing. Patient present with pigmentation of nose, cheeks, and cartilage of joints. So third group is diseases caused by mutations in gene encoding receptor proteins or channels. It includes familial hypercholesterolemia and cystic fibrosis. Familial hypercholesterolemia is autosomal dominant disorders caused by mutation in gene encoding LDL receptors. Patients develop hypercholesterolemia as a consequence of impaired transport of LDL into cell. In heterozygotes, elevated serum cholesterol greatly increases the risk of atherosclerosis and result in coronary artery disease. In homozygotes, they have even greater increase in serum cholesterol and a higher frequency of ischemic heart disease. Cholesterol can also deposit along tendon sheets to provide xanthomas. Cystic fibrosis it's an autosomal recessive disorder caused by mutation in gene encoding the cystic fibrosis transmembrane regulator. The principal defect is of chloride ion transport, resulting in high salt concentration in sweat and in viscous luminal secretion in respiratory and GI tract. I told you about cystic fibrosis in detail in my first lecture. Clinical manifestations include increased sweat chloride, sinusitis, recurrent lung infection, cirrhosis, pancreatitis. In intestine, neonatal obstruction is commonly seen and male patients are usually infertile. Thank you.